But we start out with a segment we do once a month or so, courtesy of the folks at the Center for Creative Leadership. They believe that leadership comes in many forms, and gosh, it really does. It doesn't always have to be a CEO or a congressman or somebody like that, but today we honor somebody who is a real leader. He happens to be a CEO and a president and founder. Let's take a look at our first guest, Don DeBethizy, who is the founder of Targacept. Welcome, Don.
It's great to be here.
How you doing?
Doing great.
We've always wanted to get you on the show, and thanks for coming. And I guess my first question, since we haven't really met formally, we've seen each other at some community event. Where are you from?
I'm from actually Greenbelt, Maryland, right outside of Washington, D.C. That's where I grew up. I went to the University of Maryland.
Okay.
And been down in North Carolina, though, since about 1981.
Okay. And now who were your, when you were a little boy growing up, who were your early influences or role models or mentors?
Well, I'm a real product of the space race. You know, hiding underneath a desk with the threat of nuclear war back in that time. And,
yeah, I remember that.
And then we really thought technology would provide solutions to many of man's problems. So that's what motivated me. Kennedy and the spacewalk, and a lot of my teachers. I had fabulous public school teachers.
So you knew you wanted to have something to do with technology, high-tech, research, things like that from an early age.
I was very mechanical. I grew up, my dad was a house painter, and he tinkered with everything. We had to fix everything, so I learned to repair everything there was in the house.
Can you come live with us? My wife says I can't repair anything. Let me, I don't want to spend a lot of time on R.J. Reynolds, but that you did come from that company, and you spent a lot of time at R.J. Reynolds. Your friend Betsy Anisi told me the other day, Betsy Anisi from Anisi Public Relations said Don was a great leader, a great boss, a great guy. I think you probably paid her to say that, but no, I'm just teasing. But anyway, you spent some time at Reynolds. Now, how did that get you from there to Targacept?
Well, you know, I joined Reynolds in 1985 as a bench scientist. So I started out working with my hands, doing research, and I was asked to do research on nicotine, actually. And we were part of a very small group of about 13 people, and we did research on how nicotine interacted with the body. The chemistry and the biology of the nicotine receptors emerged from that. We learned a lot about the receptors in the body. And then about the early 90s, we started patenting some of the molecules we had to help learn about the receptor. And by the mid-90s, we realized there might be a pharmaceutical application of that knowledge.
That's interesting. So now you founded Targacept, and basically just give me a few seconds on what the mission is at Targacept.
Well, the mission is to develop therapeutics to treat large unmet needs in central nervous system diseases. So Alzheimer's, depression, anxiety, schizophrenia, Parkinson's, and pain. And we have been very fortunate to be able to get all of that intellectual property out of Reynolds Tobacco. There was a tremendous amount of investment, not for any commercial reason.
Right.
Our job was to become the world's experts on how nicotine interacted with the body. We did that.
You made those discoveries there. And
we made those discoveries. We spun it out in August 2000. Reynolds owns about 4% of us, so we're a completely independent company. We're now a public company. And being a public company gives us access to capital, the large amounts of capital that's required to develop a drug.
You know, we've talked about this before, but there's been a lot of complaints from people, not against your company, but about drug companies in general, people who need specialized drugs for their treatments. Oh, it costs $4,000, $5,000, $6,000 a month. How can I afford it? And the companies usually say, well, we have all these R&D costs, research and development costs. That doesn't really mean much to somebody that's suffering. When are we going to get to a point where people can get these things in an affordable fashion?
I think we, as you know, we're in a very active dialogue in society right now about that. And I'm actually on the board of the Biotechnology Industry Organization, which is interacting with Congress, making sure that these innovations are well funded, because it takes on average, it takes $800 million to develop one drug.
Get out of here.
That's a lot of money. And now, you know, there's variation around that. It may take us a little less because we're a smaller biotech company, but it does take a lot of money to get innovative. It takes a long time. Probably takes 10 to 15 years from discovery, really 15 years, from the discovery of a drug all the way to it's in the market. For example, we discovered our drug, 1734, for Alzheimer's disease in 1997.
10 years ago.
10 years ago, and we are in phase 2, the middle stages of clinical development with our partner AstraZeneca.
Will you come back sometime? Let's talk about that. That's fascinating.
Love to talk to you
We just wanted to sort of honor you as a leader today, thanks to the Center for Creative Leadership, and we've done that, and maybe you can come back next time. We can just jaw about prices and drug therapies and business and that kind of thing. Don, thanks a lot.
Thank you.